immediately Dr. Vipin Uthappa, who's a senior interventional radiologist, came into the picture, and he suggested how we take the process forward.
An osteoid osteoma is a benign bone tumor. It's very rare, but we tend to see it often, and they present in various ways. And one of the points which we wanted to highlight was, as Srimanth said, that they can present with in various forms. And the commonest one incriminated is the possibility of infection. And that actually prolongs the journey for that particular patient because they have to see different doctors and have multiple images and sometimes under general anesthesia. And because this was a slightly unusual location because it was intra-articular, we had to take some steps to make sure that we are able to access it safely. The key thing is to get a precise location of the radiofrequency probe, which basically delivers a high thermal energy. Once we are able to pinpoint the location on the CT guidance and we have placed the needle, then we connect it to a generator and then we are able to treat it. And we were able to successfully do this procedure for this lovely kid. And 24 hours after the procedure, it was completely pain-free.
The whole process highlights that he's able to get back to his favorite sport, which is football, along with his younger brother. The energy which they come back in, it's so easy to say that such a minimal invasive procedure can give so much of results that the next day they're up and about going back to school and their favorite activity. So just to highlight again, getting the right diagnosis is very important. We as a quaternary care setup see a lot of situations like this, and even we also face challenges.
Now after the surgery, like around 2 to 3 days, I'm fine now. Because my hand is now cured, I would like to continue on my football journey.
Your services are very good and they a lot care about the child. The doctors and nurses are really helpful.